Hello, I'm Michael Hollick, and I'm Professor of Medicine, Physiology, and Biophysics, Director of the Bone Healthcare Clinic, and Director of the General Clinical Research Unit at Boston University Medical Center. My colleague, Dr. Hossein, and I had the opportunity to write a review on vitamin D for the Mayo Clinic Proceedings that will come out in the July issue. The title is Vitamin D for Health, a Global Perspective. And what we do in this review is to give you a very broad overview on vitamin D. As you are aware, vitamin D deficiency is now one of the most common medical conditions worldwide, and it's a global health issue. We first explore how vitamin D is made in the skin, how it's metabolized, and its many biologic functions in calcium and phosphate metabolism. We also review some of the mechanisms involved in the non-calcemic health benefits of vitamin D. A recent study was performed in healthy adults that had received 2,000 units of vitamin D a day for 3 months during the wintertime and had 291 genes either up or down regulated. Many of these genes controlling DNA synthesis, apoptosis, regulating oxidative damage for the skin, as well as other organs. We also review the important role that vitamin D has during pregnancy. There's evidence that vitamin D deficiency increases risk for preeclampsia and for the need for cesarean sectioning. During pregnancy, vitamin D is very important for fetal growth and development. We explore the role that vitamin D has on epigenetics and the fact that the vitamin D effect on epigenetics may have long-lasting effects for that infant throughout his or her entire life. We also explore the importance for vitamin D for childhood bone health, as well as for adult bone health, and some of the non-calcemic health benefits. We did a PubMed and Medline search and looked at many of the meta-analyses and incorporated them into a table. Many of these meta-analyses demonstrate positive association studies with enhanced vitamin D intake, improvement in musculoskeletal health, as well as non-skeletal health benefits from reducing risk of mortality, decreasing risk of common cancers, as well as autoimmune diseases, and diabetes and cardiovascular disease. But some of the studies demonstrate no benefit, and some of the studies even suggest that there may be a J-curve. That is, that if you increase your vitamin D intake, raise your blood levels of 25-hydroxyvitamin D above 30 nanograms per ml, that you may actually increase risk for mortality and some cancers. We review the possibility that that J-curve may be misinterpreted in that often patients who are vitamin D deficient being treated will now have a blood level above 30 nanograms per ml. And it may be that many of these subjects that have been in these studies have in fact been vitamin D deficient for a long period of time and were being treated. Also, often patients that have blood levels of 25-hydroxy-D above 30, 40, 50 nanograms per ml may be due to the fact that they're taking other large supplements that may potentially increase their risk for either mortality or chronic illnesses. And finally, only usually about maybe 2, maybe up to 10% of the entire population have a blood level above 30 or 40, and may also explain a kind of uptick in increasing risk for some of these diseases. We review the definition for vitamin D deficiency. There remains controversy as to whether the cutoff of 25-hydroxyvitamin D should be 20 or 30 nanograms per ml. Especially the study by Primmel in 675 adult Germans who had unfortunate accident and caused their death. Bone biopsies suggested up to 26% of otherwise healthy Germans had evidence of osteomalacia or osteoidosis, classic sign for vitamin D deficiency. We also explore how to prevent and treat vitamin D deficiency, a 3-step process. There's very little vitamin D in your diet. Typically, milk or orange juice fortified with vitamin D can provide 100 units of vitamin D. Wild-caught salmon, about 500 to 1,000 units. And, of course, mushrooms exposed to sunlight can be a good source. Recommend supplementation. Follow the endocrine practice guidelines for neonates, 400 to 1,000 units a day. For children 1 to 18 years of age, 600 to 1,000 units a day. And for adults, 1,500 to 2,000 units a day. However, if you're obese, if you're on medications like glucocorticoids that would increase the catabolism of vitamin D, then you may need more vitamin D. We don't recommend broad screening for vitamin D status, but rather to encourage people to be taking an adequate amount of vitamin D, either from diet and supplements, and of course sensible sun exposure. And of course, how do you get sensible sun exposure? Because time of day, season of the year, latitude, degree of skin pigmentation can have a significant effect. And we offer in that review a new app that's available free called dminder.info that actually can tell you how much vitamin D you make, no matter where you are on the globe, any time of the day, and any season of the year. We also review the importance that vitamin D has in terms of reducing risk of mortality, type 2 diabetes, common cancers, neurocognitive disorders, as well as infectious diseases. Vitamin D is very important for overall health and welfare. There is no downside to increasing your vitamin D intake. We should not be screening everyone for their vitamin D status, but there are groups out there that definitely need to be followed. Those that are obese, on medications that impact on vitamin D metabolism, as well as patients with fat malabsorption syndromes, and of course patients with chronic granulomatous disorders like sarcoidosis, which are at increased risk for having a hypersensitivity to vitamin D that can cause hypercalciuria and hypercalcemia. Thank you.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.